So hello dear students, welcome back to the recall session of psychiatry. First of all, I would like to congratulate you all and myself that this time all the questions of psychiatry were from my notes. 100% strike rate. So if you would have attended our missed live classes, online classes, recall sessions, T&D sessions, you would have marked all the answers of psychiatry correctly. So without wasting much time, let us move on to our session. This was your first MCQ. All these questions are actually recall based. So students, on the basis of their recall ability, they have sent questions and I have collected these MCQs and framed this session for you. So now let us have a look to our this Fmge session. First MCQ: 45-year-old person who was taking alcohol for last 7 years. He has suddenly stopped alcohol for last 2 days, means around 48 hours. He stopped alcohol for last 48 hours due to some family function. Patient developed tremors, hallucinations. He is probably suffering from. Is it delirium? Is it schizophrenia? Now, part B of this question means I have received two different verbatims of this same question. So let us look at our second part B of first question. A 45-year-old man presents to the hospital with symptoms of auditory hallucinations and an inability to recognize his own family members. Means along with auditory hallucinations, patient is also having what? Disorientation. Here patient has become disoriented, inability to recognize his family members. He reports his last alcohol intake 48 hours ago. What is the most likely diagnosis of this case? Is it alcohol induced psychosis? Is it delirium tremens? Is it schizophrenia, or is it alcoholic hallucinosis? So please reply. What do you think? According to you, what will be the correct answer? If you have attended the classes properly, sincerely in our classes, even in recall session, even in 25 most important session, I have told you multiple times that in alcohol withdrawal, we need a timeline to mark, to reach proper diagnosis. We require timeline. Here examiner has mentioned timeline and this is a repeat MCQ with different verbatim. Simple. Examiner has changed few words and presented the same question in front of you. Here it is given 48 hours. So I have told you, in alcohol withdrawal syndrome, what will be the first symptom of alcohol withdrawal? When person stops alcohol, first symptom is tremors, fine tremors, which starts 6 to 8 hours after last intake of alcohol. Isn't it? Yes. Second symptom, alcohol induced auditory hallucinations. Patient develops psychotic symptoms. Psychotic symptoms in the form of auditory hallucinations 8 to 12 hours after last intake of alcohol. Yes sir. After this, patient develops what? Withdrawal seizures, known as alcohol withdrawal seizures, which develops 24 to 48 hours after last intake of alcohol? Yes, sir. Yes, sir. Has examiner mentioned anything about jerky movement, seizures, clenching of teeth, fall on the ground? No. So there is no episode of seizure in the patient. Okay. Okay, sir. Finally, patient develops most severe complication of alcohol withdrawal, that is known as delirium tremens. That is known as delirium tremens, and delirium develops 48 to 72 hours after last intake of alcohol. So here in delirium tremens, what will you see? All the above symptoms of withdrawal. All the above symptoms of withdrawal, including tremors, auditory hallucinations, patient may have seizures, plus disorientation to time, place and person. That is delirium tremens. This is what we have written in our classes, in our notes, in our workbook. Okay. So here which are the symptoms that patient is experiencing auditory hallucinations? Yes. And patient is having disorientation to time, place and person. Mostly here in the question it is person. Examiner has given inability to recognize his family members, means disorientation to person. So definitely patient is having features of withdrawal plus disorientation. So definitely this is a case of delirium tremens. So those all who have marked answer delirium tremens, all of you are correct. Very good, excellent. I have received answers from the students and most of you are correct. Very good, excellent. It is not alcohol induced psychosis. For alcohol induced psychosis or alcoholic hallucinosis, this time period will be around 8 to 12 hours. It is 8 to 12 hours. Second, patient will not have any kind of disorientation. Patient will have only auditory hallucination. Then we can say, okay, patient is having auditory hallucinosis or alcohol induced psychosis. But here timeline has crossed almost 48 hours. Patient examiner has not mentioned anything about seizures. None of the symptoms of seizures are here in the question. So definitely patient has almost developed delirium tremens. Why not schizophrenia? Because again timeline. To diagnose schizophrenia, patient will have two out of 5 symptoms. We already know: hallucinations, delusions, disorganized speech, negative symptoms, disorganized behavior. So none of the symptoms of delusion, disorganized speech, disorganized behavior and negative symptoms in this question. Second, duration is very less. Patient has developed symptoms immediately, means within after 48 hours of stopping alcohol, and history of alcohol is there. So it is not schizophrenia. Definitely answer, 100% answer will be delirium tremens. Clear? No confusion. Now let us look at the second MCQ. Again, we have discussed this type of questions multiple times in our classes, and if you have read the question properly, you would have marked the correct answer. Now let us look at the question. A 25-year-old male previously diagnosed with a psychiatric disorder. We don't know what is the psychiatric disorder. Has become aggressive with his neighbors. Patient is speaking very fast. Patient is speaking rapidly. That means patient is having what? Flight of ideas. Patient is having flight of ideas. Patient has become aggressive. Means increased in irritability, increase in aggression, anger. So increased level of happiness or anger. Patient is having increased level of anger here in the question. Is speaking very rapidly and is sleeping very less. He also exhibits hyperactive behavior. after discontinuation of his prescribed medication. What is the most likely diagnosis? I hope from my description it would be clear that what will be the diagnosis. But still, let us look at the options. Is it depression? What happens in depression? Patient feels sadness, means there is a depressed mood, loss of pleasure in all activities, there is a lack of energy, weakness in the body. Although there is a sleep disturbance, there is increase or decrease in sleep. Patient feels worthlessness, hopelessness, there is a loss of appetite, weakness in the body. They may develop suicidal ideas. Psychomotor, there is a psychomotor retardation, means slowing of motor activity. There is a slowing of motor activity, inability to think or concentrate. They feel less self-confidence. They have low self-confidence. So is there is any symptoms of depression here in the question? No sir, there is no such symptom. So this is not depression. Okay. Is it schizophrenia? Has anything mentioned about delusion, hallucination, disorganized speech? Because we need at least one symptom out of these three. None of the symptoms are here. So this is not schizophrenia. Is there is any history of substance use? Alcohol, opioid, cannabis. So none of the information, no information about substance has mentioned in the question by the examiner. So definitely this is not substance induced mood disorder. So what it is manic episode, mania. Patient has developed mania. So if you remember, we have discussed in mania, we have discussed what happens in mania. Mood goes up. So what happens in mania? Patient feels extreme level of happiness or extreme degree of anger. Along with that angry mood, patient will have what? Dig fast. Along with angry mood, patient will also have dig fast. That means distractibility, increased self-esteem, increased goal-directed activity, flight of ideas, also known as racing of thoughts, also known as pressured speech, increased abnormal activities like hyperactive behavior. There is a decreased need for sleep and there is increased talkativeness. So yes, examiner has mentioned so many features of mania in this question. Examiner said about aggression, increased level of anger in the patient, speaking rapidly, that means flight of ideas, decreased need for sleep means sleeping very less, and hyperactive abnormal behavior. So this is a case of manic episode, that means bipolar disorder. It is mania. This is a case of mania. So most of the students they are saying that they have marked mania. So all of you are correct. Very good. Excellent. Next MCQ, again it is a repeat one, but they have given in some different format. They have presented the same question in a different format. So if you use your logic, your common sense, you can mark this question, you can mark the answer correctly. Now let us look at the MCQ. A young female reports episode of binge eating followed by self-induced vomiting. So this is a case of what? Bulimia nervosa. First patient is eating large amount of food, then vomiting it out. So this is a case of bulimia nervosa. Okay. She is most likely have which of the following acid-base disturbances? What happens in our stomach when we eat food? there occurs a secretion of HCl, acid. So when somebody repeatedly vomits, they vomit out, they vomit out acid, they vomit out acid, HCl content from their body. So when somebody is, uh, when patient is vomiting more acidic content, they are removing acidic content from their body, definitely the content of bicarbonate, means alkaline material, increase in their body. When somebody vomits acid, what happens? The content of bicarbonate, that means alkaline content, increases in their body. There is no association of respiration in this case. Here metabolically, here patient is developing some metabolic problem because of repeated vomiting. So because they are vomiting acid, they become alkaline. There is no respiratory disturbance in the patient. They are voluntarily vomiting out acid. So definitely there is metabolic alkalosis. Patient will have metabolic alkalosis. So we need to use our common sense कि भाई मैं बहुत सारा एसिड यदि बाहर निकाल दूंगा तो बॉडी में क्या होगा? बॉडी अल्कलाइन हो जाएगी. HCl मैंने बाहर निकाल दिया तो अंदर क्या बचा? अल्कलाइन चीज, यानी कि बाइकार्बोनेट, वो ज्यादा हो गया. अब क्योंकि यहाँ पे रेस्पिरेशन के साथ कोई कनेक्शन नहीं है, यहाँ पे रेस्पिरेटरी रेट बढ़ा नहीं है, ना ही वो कम हुआ है, मीन्स देर इज नो increase in respiratory rate or decrease in respiratory rate. So there is no association of respiration. There is no connection of respiration. So it could not be respiratory acidosis or alkalosis. This is clear cut. Either metabolic acidosis or alkalosis. But from our common sense, if we think that we are vomiting acid content, then definitely we become more alkaline. So we develop metabolic alkalosis. So correct answer is option number D. Okay. So this also we have discussed multiple times in our classes. First person eats, then vomit it out. That is bulimia nervosa, and what happens in bulimia nervosa we have all discussed in our regular classes. Now next MCQ. Again it is a repeat MCQ. Even I have given you example in our daily in our routine lecture. In our routine lectures I have given you this example in a different way. Now let us look at the MCQ. A doctor asks a patient about her age. Patient responds, "Do you know, doctor, I am from a village. We are married at a very young age, at 12, with my husband, who is just 5 years older than me. Then I had 2 kids. When I was around 18 or something, now I look like their older sister. I am just 32, doctor." So before giving actual response, here patient is giving unnecessary boring details. That, "Do you know, doctor, I am from a village. We were married at a very young age of 12 with my husband. My husband was just 5 years older than me when I got married. Then after my marriage, I had 2 kids when I was around 18 or something like that. Now I look like my children's older sister. And at present, I am just 32, doctor." So patient has given unnecessary boring details. So this could be what? It is circumstantiality. When patient gives unnecessary boring details before giving actual answer, that is circumstantiality. Clear? So this is a case of circumstantiality. Again, examiner has used their different logic for presenting the same question but in different format, and we have discussed this multiple times in our classes. And even I have given you example of my own, that if you ask me, "Sir, please tell me about yourself," how I present, how I give the response, and that will be known as circumstantiality. So if you remember, I have given you example in the class. So again, examiner has used different language and asked you the similar type of question. So the correct answer to this question is circumstantiality. Okay. What is tangentiality? Tangentiality. Here in tangentiality, patient just touches the topic. Patient just touches the topic but gives some different answer. This is what happens in tangentiality. So if patient has given some 2-3 words answer, like when doctor has asked her about her age, she might have told that age is a very good thing, doctor, but I am from village. So she might have talked about age, but not told, but she has not told about her actual age. So age is a good thing, doctor, I am from village. So if she has given this type of response, it could be tangentiality, but nothing has mentioned about tangentiality in this question. Why not derailment? Why not derailment? Because here patient has given relevant answer. She has told her age in last, but before telling her age, she has given some unnecessary information. What happens in derailment or loosening of association? Patient gives a totally different answer. Means question is different. When question is different and answer is different, there is no association between question and the answer, that is derailment. But here there is a clear cut association between question and the answer, so this could not be derailment. Why not flight of ideas? In flight of ideas, patient speaks very fast. They speak very fast. Is nothing has mentioned about speed in the question. Second, patient has given relevant answer in the last, and she has spoken actual things one after the other. So this could not be flight of ideas. Second, along with flight of ideas, no other symptoms of mania like elevated mood, abnormal activity, such type of symptoms are there in the question. So this is not flight of ideas because nothing has mentioned about speed in the question. So again, it is not flight of ideas. This is a clear cut case of circumstantiality. So correct answer is circumstantiality. Clear? Okay. Next MCQ. A lady presents to the hospital after having a fight with her husband. Means there is a definite stressful event happened in her life recently. She has encountered fight with her husband. Some stressful life event. She reports that she is unable to speak. Means she has become mute. However, all neurological and physical examinations are within normal limit. She does not seem to concerned about her health status. Means she is having very casual attitude. She is having very casual attitude. After fight with her husband, she is presenting to the doctor in a very casual attitude that after I had a fight with my husband, I am unable to speak. Very casual attitude. This we have discussed in our classes. I have told you when patient has least concern, or when they are less concerned about their symptoms, that is known as labile indifference, that is seen in conversion disorder. And conversion disorder develops after some stressful life event like breakup, loss of job, fight with his spouse or husband. So definitely this is labile indifference. This is not malingering. None of the symptoms of somatic symptom disorder are mentioned in the question. means there are no four pain symptoms, two neurological symptoms, four pain symptoms, two gastrointestinal symptoms, one pseudo neurological or one sexual symptom. For diagnosing somatic symptom disorder, we need more than or up to 8 symptoms. 8 symptoms for 6 months. 8 symptoms for more than 6 months means up to 2 years. For somatic symptom disorder, patient should have symptoms for at least 2 years, means more than 6 months, 2 years, up to 2 years. So here it is not case of somatic symptom disorder. This is a clear cut case of la belle indifference. Okay, next MCQ. Again, very easy one. We have discussed multiple times in our classes. What or which kind of symptoms, what or which kind of symptom does the term affective flattening imply? What does affective flattening means? Is it a positive symptom? Is it a negative symptom? Is it affective symptom or is it cognitive symptoms? What do you think? So if you remember, in schizophrenia we have discussed what about negative symptoms. Which are the negative symptoms? Anhedonia, apathy, alogia, asociality, yes, flattening of affect, flattening of affect, also known as affective flattening, and ambivalence. These all are the negative symptoms that we see in schizophrenia. So they are asking about flattening of affect. So definitely affective flattening is one of the negative symptoms of schizophrenia. Clear? Which are the positive symptoms? If you remember, we have already discussed positive symptoms: delusions, hallucinations, and disorganized speech. These three are known as the positive symptoms of schizophrenia. Affective symptoms means mood symptoms. Mood symptoms. If patient is feeling depressed, if patient is feeling depressed, or patient is feeling extreme degree of happiness or anger, those are known as affective or mood symptoms. So none of the mood symptoms are there in the question. Definitely it is not. Cognitive symptoms. If patient is having problem with memory, problem in recalling, problem in remembering things, all those are known as cognitive symptoms. So none of the symptoms of memory impairment are there in the question. So definitely this is negative symptom. Affective flattening means negative symptom. This is one of the negative symptoms of schizophrenia. Clear? Okay. Now the last MCQ. Look, there are 7 questions from psychiatry. So do you understand the weightage of psychiatry? Single mistake means you could have lost your this attempt. You could have failed the exam. So each and every MCQ matters. So 7 MCQs from psychiatry. Even if you have marked 6 out of 7 correctly, then also I will guarantee that those who have marked 6 out of 7 correctly, all those will pass their exam. It's my guarantee. So weightage is quite high. Okay. Next MCQ. A 28-year-old woman diagnosed with schizophrenia had been compliant with her prescribed olanzapine for several months. She was taking olanzapine for several months. 28-year-old woman, means young female. However, she discontinued the treatment. Which of the following is the most likely reason for her discontinuation? After consuming olanzapine for long period of time, she has discontinued the medicine. Due to, is it due to weight gain? Is it due to tardive dyskinesia? Is it due to acute dystonia, or is it due to akathisia? First of all, if patient has consumed olanzapine for long period of time, so she could not have acute dystonia because it develops immediately after consuming antipsychotic drugs. It develops within hours, within days of starting of treatment. So it could not be acute dystonia. Second, examiner has not mentioned anything about acute dystonia. Is there is any twisting movement written in the question? No. Is there is any symptom like protrusion of tongue written in the question? No. So none of the symptoms of acute dystonia is there in the question. Okay, so this could not be acute dystonia. Why not akathisia? Akathisia is the most common side effect of antipsychotic drug. Feeling of inner restlessness. Feeling of inner restlessness. Most common side effect, can develop any time, but develop more often with first generation antipsychotic drug. And this akathisia is not one of the reasons for stopping treatment. We can add propranolol beta blocker to antipsychotic drug and patient will continue their medication like before. So this is not akathisia. Secondly, again, none of the symptoms of akathisia are there in the question. Examiner has not mentioned anything about akathisia in the question. Second, tardive dyskinesia. Okay, now we have a confusion between these two options. It could be either weight gain or it could be either tardive dyskinesia. So tardive dyskinesia most often develops after consumption of first generation antipsychotic drugs, or drugs those who are more potent antipsychotic drugs. So more potent antipsychotic drugs produces tardive dyskinesia when consumed for long period of time. Second, in tardive dyskinesia, what happens? Patient develops some abnormal involuntary movements. And this side effect is more common in males. It is more common in males seen with potent antipsychotic medication when taken for long period of time. So late onset side effect. Again, when patient develops this side effect, they do not know, they do not have insight that they have developed some this type of movement disorder because of this medication. They do not feel that, because they do not know that, oh, this I have developed this tardive dyskinesia because of this this medication. Again, examiner has not mentioned anything about tardive dyskinesia in the question. Has examiner mentioned anything about abnormal involuntary movement? That is why her relatives, because patient has developed abnormal movements, her relatives, not patient, her relatives have stopped the medication. Here patient herself has stopped the medication. And why we stop our medication? When we see changes in ourselves, that could be weight gain. That will be weight gain. So young female, when she gains weight, extra weight, when she put on extra weight, she feels, oh, because I am consuming this medication for last 6 months, I have gained my weight from 60 kgs to 90 kg. Most common antipsychotic drug which causes weight gain is clozapine. Yes, we have discussed in our classes, followed by olanzapine. So again, patient here is taking olanzapine and she has seen some abnormal changes in herself. Might be because she is about to marry, she is thinking of marriage or other type of things, looking for a job. So if she gains weight, definitely she will stop her medication. So the correct answer to this question is weight gain. And we know most common drug that produces weight gain, one is clozapine followed by olanzapine. So here patient is consuming olanzapine, so definitely she is facing problem of weight gain. That is why she herself has stopped the treatment. So these are the 7 questions which I have received from the students. It is totally recall based. Your actual question might be different from these questions. So but almost these questions will mimic your actual questions of the exam. So that's all from my side, and this time all 100% strike rate in psychiatry. All the best to my dear students. Thank you so much for attending this recall based session. So many students, they contacted me before the exams. Some of them feeling low, some of you are feeling stressed before the exam. So anytime whenever you face any difficulty related to your exam, related to your result, related to your personal professional life, I am there for you. Don't worry, be happy, think positive, be positive, and I hope you all will pass your exam. So all the best.